This is quick-fire syncope questions on beta blockers. Mel, what is a beta blocker?
A beta blocker, or a beta adrenoreceptor antagonist, blocks the beta receptors in the heart. So it results in a reduction in inotropy and chronotropy, or heart rate and contractility.
So it blocks the sympathetic or fight or flight response?
Exactly.
Okay, good. And so what are the most common beta blockers that we prescribe for our patients?
So in syncope, the most common beta blocker we prescribe is propranolol. This is a non-cardioselective beta blocker, and the additive benefits of this is that it can reduce the adrenergic response that a lot of our POTS or syncope patients have with stress, tremor, hypertension and tachycardia. We can also use bisoprolol. It's a much more cardioselective beta blocker if we need to, if there are other indications, or if we want a more cardioselective, if there's a history of cardiac disease.
Okay, what is the dose of propranolol that you would start one of your syncope or POTS patients on?
We typically start a much lower dose than we would for other indications, so 10 milligrams twice a day, a very low dose. The reason for this is we know that a lot of our patients actually have a problem with venous pooling and reduced cardiac venous return. So we don't really want blood pressure lowering effects, but we want the anti-adrenergic effects of the stress and the tachycardia. Patients who are on higher doses can sometimes then develop orthostatic intolerance or orthostatic hypotension. We would prescribe beta blockers for our patients with POTS or orthostatic intolerance who have a normal or normal to high blood pressure. These are not drugs that we would use in our patients with a low blood pressure phenotype, because that might make their symptoms worse, or unless it was combined with a vasoconstrictor.
And what would the drug of choice be then if you have a patient with a low blood pressure but symptoms of palpitations?
But for whom we still want to reduce the palpitations, Ivabradine. And
Good.
you can see the other video on our website.
Okay, good. So in terms of the beta blockers, what are the most common side effects and contraindications for prescribing?
So the side effects that most of our patients complain of are fatigue. In men, erectile dysfunction can be considered. Obviously, in patients with asthma, if they're on inhalers and requiring daily inhalers, then we'd be very cautious about prescribing them. Sometimes it could be a trial to see if their asthma gets worse, and it would certainly be a more cardioselective beta blocker, but we would prefer to avoid it completely.
Okay, and what should patients look out for if they are prescribed a beta blocker in terms of warning signs?
It's a good idea for a patient to monitor their blood pressure on beta blocker, particularly our patients, because of that risk of orthostatic hypotension. They should also look for the symptoms of worsening orthostatic intolerance symptoms, in which case it might not be the right medication. If they have particularly pronounced fatigue, that's something. Obviously, a side effect of a beta blocker is going to be a reduction in the heart rate. This is not something we would normally worry about too much, but if the heart rate is consistently, say, lower than 55, then the patient might start to feel tired.
Okay, good. So in summary, beta blockers, very helpful. They're anti-adrenaline drugs that will help calm all the general symptoms of having the hyperadrenergic state and can be very useful for palpitations.
And they can be helpful for POTS patients in particular who have tachycardia and hypertension, because they work on the blood pressure as well.
Excellent, thank you.